I want to tell you about a woman I'll never forget. I'll call her Dorothy. Dorothy was 71 years old, a retired English teacher from Charleston, South Carolina. She was the kind of woman who remembered every birthday in her extended family without ever looking at a calendar. She read 2 books a week. She did the New York Times crossword in ink, never pencil. Then, over the course of about 18 months, Dorothy began to disappear. She forgot her granddaughter's name at a Christmas dinner. She got lost driving home from the same grocery store she had been visiting for 30 years. She would ask her husband the same question 4 times in a single afternoon. Her family was devastated. Her doctor diagnosed her with early-onset Alzheimer's disease and prescribed her a medication called Dumpazole. But here is what nobody, not one single physician in her care, ever asked Dorothy. What other medications was she taking? Because when I finally sat down with Dorothy and her daughter, and I asked that question, the answer changed everything. Dorothy was taking a sleep aid every single night. She was taking a bladder control medication twice a day. She was taking an over-the-counter allergy pill every morning. And she had been on a low-dose antidepressant for 11 years. Within 4 months of carefully and safely reducing those medications under my supervision, Dorothy came back. The crosswords returned. The names returned. Her granddaughter's birthday returned to its proper place in her mind. Dorothy never had Alzheimer's disease. Dorothy had been slowly poisoned by her own medicine cabinet. And here is the most painful truth I have learned in over 2 decades of medical practice. Dorothy's story is not rare. It is happening to millions of seniors right now, today, in this country. And almost nobody is talking about it. My name is Dr. Franklin, and today I am going to walk you through the 7 medications that researchers have now directly linked to memory loss, confusion, and dementia-like symptoms in adults over 60. Some of these are prescription, some of these are sitting in your bathroom cabinet right now, and you bought them without a prescription. Stay with me through all 7, because number 3 is taken by nearly half of all seniors over 65, and almost none of them have been warned. And number 1? Number 1 is so common that the FDA itself has issued multiple warnings about it, yet doctors continue prescribing it every day. Before we begin, drop a comment below and tell me your age and which medications you currently take. I read every single comment. Your story might be exactly what someone else needs to read today. Alright, let us begin. Before I name these 7 medications, you need to understand one critical concept that will make everything I say next click into place. There is a chemical messenger inside your brain called acetylcholine. I know that sounds technical, so I want you to think of acetylcholine as the postal service of your brain. It carries every memory, every name, every face, every word from one neuron to the next. Without it, communication inside your brain comes to a halt. Here is the problem. After the age of 60, your body naturally produces less acetylcholine. By the time you turn 75, your brain may have only 60 to 70% of the acetylcholine it had at age 30. Now imagine you are running a city with only 60% of your postal workers. The mail still gets delivered, but it is slower. Some letters get lost. Important messages arrive late or not at all. That is your aging brain doing its best to function with reduced resources. Now imagine you take a medication that blocks even more of those postal workers from doing their jobs. Suddenly the city is in chaos. Mail piles up, communication breaks down. And from the outside, it looks like the city is failing. But the city is not failing. It is being sabotaged. The medications I am about to discuss are called anticholinergics. That word is going to come up several times in this video, so I want you to remember it. Anticholinergics block acetylcholine, and in an aging brain, that blockade can be catastrophic. A 2024 study published in JAMA Internal Medicine tracked over 350,000 adults aged 65 and older. The researchers found that those who used strong anticholinergic medications for more than 3 years had a 54% higher risk of developing dementia compared to those who did not. That is not a small number. That is the difference between aging with a sharp mind and watching your identity fade away. Now let us name these medications. Coming in at number 7 is a medication that is sitting in roughly 90% of American medicine cabinets right now, diphenhydramine. But here is what most seniors do not realize. Diphenhydramine is not just in allergy pills. It is hidden inside dozens of other products, anything labeled PM for nighttime use, Tylenol PM, Advil PM, Zeuquil, Unisom, most over-the-counter sleep aids on the market. They almost all contain diphenhydramine as their active sleep ingredient. And diphenhydramine is one of the most potent anticholinergic medications you can purchase without a prescription. Every single night that a senior takes a PM pill to sleep, they are blocking the postal workers in their brain for the next 8 to 12 hours. Over weeks, months, and years, the cumulative damage to memory and cognition is real and measurable. A landmark study from the University of Washington found that adults over 65 who used diphenhydramine regularly for 3 years or more had visible shrinkage in the hippocampus, the part of the brain responsible for memory formation. They could literally see the damage on brain scans. Let me give you an analogy. Imagine your brain is a library. Each book is a memory. The librarians who shelve those books, retrieve them, and keep the entire system organized are powered by acetylcholine. Every Benadryl PM you take is like sending half of those librarians home for the night. Once or twice, the library still functions in the morning. But what happens after 1,000 nights of sending the librarians home? The library falls into disarray. Books are misplaced, some go missing entirely. That is what is happening to seniors who use these sleep aids nightly. The library is being slowly disorganized, one night at a time. The fix is simple. For sleep, talk to your doctor about melatonin in low doses, magnesium glycinate, or behavioral techniques that do not interfere with brain chemistry. For allergies, ask for second-generation antihistamines like loratadine or cetirizine. They do not cross the blood-brain barrier the same way and are considered far safer for older adults. Number 6 is a medication that millions of seniors take with absolutely no idea what it is doing to their minds. Oxybutynin, prescribed for overactive bladder, sold under brand names like Ditropan and others. I want to be careful here because overactive bladder is a real and embarrassing condition that affects quality of life. I am not dismissing it. What I am telling you is that the medication most commonly prescribed to treat it is one of the strongest anticholinergic drugs in widespread use today. Here is what is happening. Oxybutynin works by blocking acetylcholine signals to the bladder muscle. Sounds reasonable, right? But here is what your doctor may not have told you. Oxybutynin does not stay in your bladder. It travels through your bloodstream and crosses directly into your brain, where it blocks acetylcholine signals there too. A comprehensive 2023 review in the British Medical Journal found that seniors who used oxybutynin for more than 1 year had a 49% higher risk of being diagnosed with dementia, almost 1 in 2. And the most heartbreaking part is that the early symptoms, forgetting appointments, repeating questions, losing words mid-sentence, are almost universally chalked up to just getting older. The medication is never questioned. I had a patient named Robert, 76, a retired engineer from Cleveland. He had been on oxybutynin for nearly 6 years for his bladder. His wife brought him in because she was convinced he was developing Alzheimer's. We carefully transitioned him to a newer bladder medication called mirabegron, which works through a completely different mechanism and does not affect acetylcholine. Within 5 months, Robert's wife told me she had her husband back. If you are taking oxybutynin and you have noticed any cognitive changes, please bring this video to your urologist or primary care physician. There are alternatives. Newer medications like mirabegron, sold under the brand Myrbetriq, carry dramatically less cognitive risk and may be appropriate for you. If you are still here with me and finding this helpful, please type the number 6 in the comments. This tells me you are still watching, and it helps this video reach more seniors who need to hear this. Number 5 is one of the most overprescribed medication classes in the entire world, proton pump inhibitors, or PPIs. You may know them by their brand names, Prilosec, Nexium, Prevacid, Protonix. Most seniors have been on these pills for years, often for over a decade, with no one ever suggesting they try to stop. But these medications were never designed for long-term use. The original FDA approval was for 8 to 12 weeks. Yet I see patients every week who have been on them for 15 or 20 years straight. Here is the brain connection that almost no one discusses. PPIs work by drastically reducing stomach acid. Sounds harmless until you understand that your stomach acid does something absolutely critical. It extracts vitamin B12 from the food you eat. B12 is not optional for brain health. It is the nutrient your nervous system needs to maintain the protective coating around your nerves and to produce the brain chemicals that keep your memory sharp. Without B12, you develop what clinicians call subacute combined degeneration. The early symptoms? Memory loss, confusion, difficulty concentrating, personality changes. The exact symptoms that get misdiagnosed as early Alzheimer's disease. A massive 2024 analysis in JAMA Neurology examined over 73,000 adults aged 75 and older and found that long-term PPI users had a 44% higher risk of dementia compared to non-users, and researchers have now identified a second mechanism. PPIs may also accelerate the accumulation of amyloid beta plaques in the brain. These are the same toxic protein deposits found in the brains of Alzheimer's patients. Think of it this way. PPIs are like turning off the engine in a delivery truck that is supposed to bring vitamin B12 to your brain. The truck stops running, the brain stops receiving the nutrient it needs, and the damage that follows looks exactly like Alzheimer's disease. What do? Do not stop these medications abruptly. That can cause severe rebound acid problems. Talk to your doctor about a slow tapering plan, using H2 blockers like famotidine, sold as Pepcid, as a bridge. Eat smaller meals. Avoid eating within 3 hours of bedtime. Elevate the head of your bed slightly. And if you must remain on a PPI long-term, ask your doctor to test your B12 levels every 12 months and supplement aggressively if they drop. Number 4 is a category of medications that has helped millions of people manage anxiety and insomnia, and I want to handle this with care because I know many seniors have been prescribed these and felt genuine relief. Benzodiazepines, also called benzos, drugs like Xanax, alprazolam, Valium, diazepam, Ativan, lorazepam, Klonopin, clonazepam. For short-term use, these medications can be life-changing. For long-term use in adults over 60, the research is now alarming. Benzodiazepines work by amplifying a calming brain chemical called GABA. In the short term, this produces a wonderful sense of relaxation. The problem is, what happens when that mechanism stays switched on for months or years? A 2022 study tracking over 8,000 seniors over a 6-year period found that those who used benzodiazepines for more than 3 months had a 51% increased risk of being diagnosed with Alzheimer's disease. The risk was highest with long-acting versions like diazepam, which build up in your fatty tissues, including the fatty tissue of your brain itself. Here is what is happening biologically. When GABA is chronically over-amplified, your brain reduces its own natural activity in response. Your neurons stop firing at full strength. Neuroplasticity, the brain's ability to form new connections and adapt, begins to deteriorate. Memory encoding slows. Emotional regulation falters. I want you to imagine your brain like a finely tuned orchestra. GABA is the conductor that tells the musicians to play softer when things get loud. Benzodiazepines force the conductor to keep waving the softer signal constantly. Eventually, the musicians forget how to play loudly at all, even when the music calls for it. And here is the trap. Stopping these medications can cause severe withdrawal that feels worse than the original problem, so patients stay on them, and the damage continues. Critical safety note. Never stop a benzodiazepine abruptly. Withdrawal can be medically dangerous and in some cases life-threatening. Work with a qualified physician on a slow, supervised tapering plan, sometimes over many months. Alternatives include buspirone for anxiety, cognitive behavioral therapy for insomnia, and in some cases low-dose melatonin or magnesium for sleep. Now we arrive at number 3. And this medication surprises my patients every single time, because it is rarely prescribed for psychiatric reasons anymore. It is hidden in plain sight, used for completely unrelated conditions. Amitriptyline, sold under brand names like Elavil. It is an old tricyclic antidepressant that doctors now prescribe for nerve pain, migraine prevention, fibromyalgia, and even insomnia. Here is what makes amitriptyline uniquely dangerous for seniors. It is one of the most potently anticholinergic medications still in widespread use today. Its ability to block acetylcholine is far higher than most allergy medications, sleep aids, or bladder medications. And because it is prescribed for chronic conditions, patients often take it every single night for years. A landmark 2015 study in JAMA Internal Medicine examined over 3,400 adults aged 65 and older. The researchers tracked their medication use for over a decade. They found that adults with high cumulative anticholinergic exposure, with amitriptyline being one of the top contributors, had a 54% greater risk of dementia diagnosis. And the damage was not dose-dependent in the dramatic way most people expect. Even low, steady doses over years created significant cumulative burden. What I find most troubling is the invisibility of the damage. There is rarely a dramatic warning sign. There is just a slow, creeping erosion, word-finding difficulties, trouble following recipes, a growing inability to hold complex thoughts, and it gets attributed to normal aging for years before anyone thinks to look at the medication. Let me share one more story. Helen, 78, from Tucson, Arizona. She had been on amitriptyline for 9 years for chronic neck pain. Her family had quietly started planning for memory care. We transitioned her to duloxetine, which is much safer for the aging brain. Within 7 months, her sister told me, "Helen is asking about books again. She is asking questions. She is back." Safer alternatives for nerve pain include duloxetine, sold as Cymbalta, or gabapentin. For sleep, low-dose doxepin has a much more favorable receptor profile than amitriptyline. For mood, modern SSRIs like sertraline, sold as Zoloft, are significantly safer for older adults. Number 2 is going to surprise some of you, and I want to be very careful here. I am not telling you to stop a medication that may be saving your life. Statins genuinely prevent heart attacks and strokes for many seniors. What I am telling you is that not all statins are equal, and the type your doctor prescribed may matter more than you realize. There are 2 categories of statins: lipophilic statins, which dissolve easily in fat and cross the blood-brain barrier, and hydrophilic statins, which dissolve in water and largely stay out of the brain. The lipophilic statins include simvastatin, sold as Zocor, atorvastatin, sold as Lipitor, and lovastatin. These are the ones most commonly prescribed. Here is the issue. Your brain is composed of nearly 60% fat. Cholesterol is not a villain inside your brain. It is a structural necessity. It forms the protective coating around your nerves called myelin. It is critical for forming synapses, the connections between brain cells. Without adequate cholesterol in the brain, neurons cannot communicate efficiently. When you take a lipophilic statin, you are lowering cholesterol systemically, including in the brain itself. In 2012, the FDA updated statin labeling to officially include warnings about memory loss and confusion as potential side effects. That was 14 years ago, and yet most patients I see today have never been warned about it by the doctor who prescribed it. A 2023 analysis in Frontiers in Aging Neuroscience found that seniors over 70 on high-dose lipophilic statins for 3 or more consecutive years showed a measurable increase in mild cognitive impairment compared to non-users. But here is the good news. Hydrophilic statins like pravastatin and rosuvastatin, sold as Crestor, have shown significantly less cognitive impact in comparative studies. They provide cardiovascular protection without crossing into the brain in the same way. If you are on a statin and you have noticed brain fog or memory changes, please ask your doctor a very specific question. Ask, could we discuss whether a hydrophilic statin would give me cardiovascular protection with less impact on my cognition? Also ask to have your CoQ10 levels checked. Statins deplete this compound, which your brain uses for cellular energy. If you have made it this far, please hit the like button. It tells YouTube that this content matters to seniors, and it helps the algorithm push it to more people who need to see it. And now we arrive at number 1. And I told you at the beginning that number 1 was so common the FDA has warned about it for over a decade, yet doctors continue prescribing it every single day. But here is the truth that I think will surprise you. Number 1 is not a single medication. Number 1 is what happens when you take multiple medications from this list at the same time. The medical term for this is anticholinergic polypharmacy, and it is, in my professional opinion, the single most under-recognized cause of dementia-like symptoms in seniors today. Here is what is happening in the real world. The average American over 65 takes 4 or more prescription medications daily. Many take 6, 8, 10 or more, plus over-the-counter products, plus supplements, all prescribed by different doctors, often a cardiologist, a primary care physician, a urologist, a rheumatologist, none of whom are looking at the full picture together. When several of those medications have anticholinergic properties, the effects do not just add together. Research suggests they can multiply. A 2022 analysis in the journal Age and Aging tracked over 280,000 older adults. Those with the highest anticholinergic burden, measured using a validated tool called the Anticholinergic Cognitive Burden Scale, had a 120% increased risk of dementia over a 10-year period. 120%, more than double. Let me show you what this looks like in real life. Picture a 73-year-old woman. She takes Benadryl PM every night to sleep. She takes oxybutynin twice a day for her bladder. She was recently prescribed amitriptyline for back pain, and she takes an over-the-counter heartburn pill every morning. Each prescribing doctor said the medication was appropriate and safe. None of them considered her total anticholinergic load. Together, her cognitive burden score is in a range associated with significant dementia risk, and nobody, not one physician, has done the math on her behalf. This is not a hypothetical. This is exactly what I see in my office every single week. Here is what I want you to hear, and I want you to hear it clearly. Drug-induced cognitive decline is often reversible. I have seen it happen with my own eyes in my own patients dozens of times. When the medication burden is identified and systematically reduced under proper medical supervision, many patients experience a remarkable recovery of mental clarity. Memory returns. Personality reemerges. The fog lifts. Your brain is not a passive organ. It is adaptive. It is resilient. It is capable of healing when you give it the conditions to do so. So what do you do with this information? Here is your 5-step action plan starting today. Step 1. Write down every single thing you take. Every prescription. Every over-the-counter product. Every supplement. Every sleep aid. Every allergy pill. Do not leave anything out, even the medications you only take occasionally. Step 2. Look up each item on the Anticholinergic Cognitive Burden Scale. This is a free, publicly available tool you can find with a simple internet search. Each medication is scored from 0 to 3 based on how strongly anticholinergic it is. Step 3. Schedule a medication review with your primary care physician. Use this exact phrase: I would like a comprehensive medication review to assess my anticholinergic burden. A good doctor will not be offended. They will respect that you are an engaged, informed patient. Step 4. Ask your doctor specifically about deprescribing. This is the intentional, supervised process of tapering off medications that may no longer be necessary or that carry unacceptable cognitive risk. Deprescribing is a real and growing field of geriatric medicine. Step 5. If your doctor dismisses your concerns or refuses to engage with this conversation, get a second opinion. You are not being difficult. You are being responsible about your own brain. A geriatric pharmacist, yes, that specialization exists, can perform an even more comprehensive medication review. Before I close, I want to say something that has nothing to do with medicine. The single most precious thing you have as you age is not your money. It is not your home. It is not even your health in the broadest sense. It is your mind, your memories, your stories, your inside jokes with your spouse, your grandchildren's names, the way you laugh when you remember something funny from 40 years ago. The wisdom you have accumulated over a lifetime of living, loving, struggling, and triumphing. When that begins to disappear, everything else loses meaning. And I refuse to accept that millions of seniors are losing their minds, their dignity, their identities, not because of disease, but because of medications they were never warned about. You deserve better. You deserve a healthcare system that looks at your whole picture. You deserve doctors who ask the right questions. And until that system catches up to the science, you deserve the information to protect yourself. Today, you got that information. What you do with it over the next 30 days will quietly shape the rest of your life. Now I want to hear from you. Drop a comment below and tell me which of these 7 medications surprised you the most. Was it the sleep aids, the bladder pills, the acid reflux pills? Or did number 1, the hidden combination effect, stop you in your tracks? And if anyone you love is taking multiple medications from this list, please share this video with them. The person who needs this information most is almost certainly not searching for it. You might be the only reason it ever reaches them. If this video gave you a single piece of information you did not have an hour ago, please hit the like button. It tells YouTube to show this video to more seniors who urgently need to hear this. Subscribe to this channel and hit the bell. Every single week, I publish content like this, designed specifically for adults over 60 who want to take control of their health in ways the medical system never taught them. Next week, I will be covering the 3 foods that scientifically rebuild memory and brain volume in seniors over 60. One of them is sitting in your kitchen right now, and you have probably never thought of it as a brain food. You will not want to miss it. Until then, protect that brain. It is the most valuable thing you own. And now, you have the tools to defend it. I am Dr. Franklin. I will see you in the next one.